All right, let's dig a little deeper now into this breakthrough treatment with our investigative reporter, Brendan Kirby. Now, Brendan, tell us more about this hopeful development in the UK.
Yeah, that's right, Byron. COVID-19 patients that are on ventilation die in high numbers. That's something we know. And they often languish for more than a week, which can exacerbate hospital overcrowding. Previous treatments that have shown some promise generally have been much more effective at the early stages of this disease. But now, as you just heard, Oxford University in England reports success with a steroid drug called dexamethasone. And the best news is that it's cheap. Researchers examined about 6,400 hospitalized patients. About 2,100 of them got low doses of the drug for 10 days, while the rest received standard treatments. The results, and they're not yet published in a peer-reviewed journal, showed that after 28 days, it reduced deaths in patients receiving ventilation by a third. It also cut deaths by a fifth among patients getting standard oxygen treatment, though it didn't appear to have much impact on patients who didn't need respiratory support. State Hospital Association President and CEO Dr. Don Williamson tells me doctors in Montgomery have been using steroids for some time to treat the disease. This isn't a cure, Byron, but this is certainly extremely promising.
It certainly is, Brendan. Scientists also hard at work here in the United States. Now, tell us about the latest research that's going on here.
Well, Byron, the National Institutes of Health today launched an initiative around a database called All of Us Research Program, which was created in 2018 for use in medical research studies of all aspects of health all around the country. The initiative announced today will cover 3 aspects related to COVID-19: antibody testing, a survey of the pandemic's impacts, and electronic health records. The antibody testing analyzes blood samples from 10,000 participants, starting with samples collected in March and then working backward until there's no positive test to be found. The goal here is to find out how many people have had the virus in the past but no longer have symptoms, if they ever did. Blood registering for antibodies likely will undergo further analysis to determine if it is for the novel coronavirus specifically and determine the level of the immune system's response. The survey will involve a 20 to 30 minute online questionnaire given to participants who have been ill as well as those who have not. Given monthly so that NIS researchers can track differences over time, it will include questions about symptoms, stress, social distancing, and the economic impact of the coronavirus. Researchers will also collect electronic health records of participants. Scientists hope to learn more about the symptoms as well as the effectiveness of various treatments. Now, you can volunteer to participate by going to joinallofus.org.
Wow, fingers crossed on both of these projects. Thanks, Brendan Kirby. And Brendan will be back with us on Fox 10 News at 9 with more of your questions about the coronavirus. And if you have a question, you can email Brendan directly. Here's his email address, brendan.kirby@fox10tv.com.